Coffee, I need coffee. It's here. It's an ankle and a foot. And it says trauma 2 months ago. That's what we have. So let's do a proper guesswork on this exam. They didn't do contrast enhancement. So this is really a useless foot exam because you need contrast enhancement on feet. But let's work something out of this. Just hope this is a proper exam, not just a make-believe scan like most. Fingers crossed. It's downloading. It's here. Let's open up. It's crap. Yes, it's crap. It's awful. Oh, it's that kind of crappy scan. Yes, that kind of crappy scans you guys love. Oh crap. So this is a male patient, 23 years of age. So we're not supposed to find arthrosis here, just some kind of inflammatory or post-traumatic disease. So I can clearly see on the sagittal view of the ankle that we have some kind of edema on the talus, on the tibia, right there. Also, we have a fracture right there, a oblique fracture. It hasn't healed. It's clearly open, and it seems, yes, some cortical irregularities right there on the tip of the fibula. So fracture. Yes, a fracture. That this could be also a tiny fracture right there. This is really common on trauma. Tiny fractures of the articular surface of the posterior aspect of the tibia and a oblique fracture of the extremity of the fibula. That's quite common. And of course, there are incomplete fractures, see, on the talus. So right there, incomplete fractures. See those incomplete fractures, a complete oblique fracture, and tiny, probably tiny fractures right there on the tibia, which are really common in these cases. And we have edema all over the tarsus. What the heck is this? And the base of the metatarsus also. We have edema of soft tissue, and we have mild hypertrophy of the muscles because this patient clearly can't walk, can't put this foot down and walk because he has a unhealed fracture right there, and it seems he didn't get a cast for his feet, which tells us a lot about how he was taken care of after this fracture took place. So he probably didn't go see a doctor because he was expecting to heal all by himself without a proper treatment. Why not? Just let's take a chance and see if it heals by itself. Maybe there is a fracture here. Just going to check. Yes, those incomplete fractures are there. Yes, also on the anterior aspect of the subchondral bone of the calcaneus, right there, incomplete fractures. This was major trauma for sure. Let's see if the ligaments are torn. The fibulocalcaneal is fine. or at least it's supposed to be right there. And talofibular ligament, anterior and posterior, are fine. Let's see the deltoid complex. Seems okay, nothing much.